There are really over 100 types of arthritis. The big distinction I try to explain to my patients is, do you have a degenerative aging type of arthritis? Do you have an acute tendonitis, bursitis, back problem, spasm, which everyone has once in a while? Or do you have an inflammatory arthritis, which is a little less common? These are types of diseases like rheumatoid, lupus, scleroderma, that we also treat as well.
So really now we've got patients with all kinds of different types of inflammation, joint pain, back pain, right? And they come to you, and you guys have an amazing practice. I've been to your practice, and I'm just so impressed by the amount of resources that you've committed in your practice. Why don't you tell us a little bit about what you have there?
Well, thank you, Ken. I'm really proud of our practice. I joined it in 1990, and there are 5 doctors. And unlike most practices, we don't tell patients they can only see us if it's a back problem, or if it's a knee problem, or if it's a neck problem. We treat anything that hurts. And literally, if you don't even know what's wrong with you, come see us, we'll figure it out.
That's great.
Okay? And I think that's what takes our practice and stands out from other types of practices. We, under one roof, have X-ray, which you obviously need to make a diagnosis, but we also have MRI. So sometimes patients need further evaluation, a full lab if blood work is required, in addition to bone density testing for osteoporosis, and other types of modalities under one roof, which is really convenient for the patient. But also there's chronic pain from neuropathy, shingles pain that can lead to chronic nerve pain, and this is a very painful condition, and there's a variety of medications that can be used to help with the pain that we use quite a bit. And then there's another type of chronic pain patient, which is the fibromyalgia patient.
Sure, we all heard a lot about that, but nobody's really sure when you have fibromyalgia.
Exactly. And so it's a real condition. It needs to be diagnosed by a rheumatologist, and it needs to be treated appropriately. And I believe that with the new medications that have come on over the last few years that we help conduct some of the clinical trials with, patients are in a much better position to deal with this chronic problem.
Well, and you just brought something up. I mean, we could talk for hours because there's so much going on at Arthritis Associates. Clinical trials, modalities, physical therapy. Again, you guys keep taking care of patients that have all kinds of pain. You do it without surgery, and we hope all of you will go and you'll see Dr. Sachs. Can you tell everybody a little bit about what's happening with PRP these days?
Sure. It's a great question, and it's newer in terms of being in the mainstream. And PRP is interesting in that what we're going to do is you're taking whole blood from the patient, where we draw it just like you would on a regular drawing blood.
Right out of your arm.
Yeah, draw it right out of your arm, and then we, that goes into a tube that we then transfer into a centrifuge. That's spun up so we can separate the whole blood from the platelets. Because what we're talking about when we talk about PRP is platelet-rich plasma. And the reason that this PRP is important and can be effective in treating patients is a very concentrated amount of growth factors, which can help promote healing to inflamed tendons, damaged tendons, torn tendons, ligaments, arthritic joints, damaged cartilage, and things of that nature. So, when we are able to do this and then put everything together, we can then administer this platelet-rich plasma back into the joint that is, or the tendon that is inflamed, and we've seen very good results with that in patients that get, even long-term, better improvement than if they're using steroid injections, or in the knees where we do the viscose supplementation.
Right. Well, I'm going to tell you, I had success with it, and it's one of those things where you're right. It basically is just putting my own blood right back into my body is what it was. And to me, that was the best. When you're looking for alternatives to medicines and alternatives to something that somebody manufactured, when you're able to pull blood right out of your arm like you would for a normal draw and then reinsert it and get the medicinal benefits of your own healing power, that's why we started the show in the first place. Dr. Mike Endelicato from Delray Beach, Florida, thank you so much for being on the show, and I hope you'll come back and see us soon.
I will, definitely. Thanks for having me.
Thank you.
So when patients have chronic knee pain, usually that's due to arthritis. Let me show you an example of what a knee looks like and what exactly we're doing when we do injections. So this is a right knee, and what you're looking at here on the top, this is the patellar tendon, and then I can lift this away and you can see inside the joint. Here is the medial collateral ligament, or the inside part of the knee, and the lateral collateral ligament, what's on the outside. Right here in the center is where the ACL is, and that helps stabilize the knee. The blue coloring here is the cartilage, and then there's also the meniscal ligaments, which are here on the inside part of the knee and the outside part of the knee as well. So when we're doing an injection, our goal is to get into the knee joint. Here is the top part of the knee joint and the bottom portion. So you can see there's, right in here is where we're giving the injection. So typically these injections can be done either from the lateral side, the medial side, which is this side going in through this direction, right through where this hole is right here. That's where we'll insert the needle. Or we can go on the lateral side, on the outside part of the knee, and go in the same way. Sometimes doctors will do these injections where the patient is sitting up, and they'll go in from an anterior or the front of the knee approach, but also on the side here. They're not going through this tendon, they're going to go to the side of it, so they get right into that knee joint. After that, we'll administer whatever medication is there, whether that be steroid injections, viscosupplementation, or PRP. And usually it's pretty well tolerated, and patients, do very well with it and are able to walk right out of the office.
There's the conversation in public about mainstream medicine and alternative medicine. Everybody says, oh, I'm going alternative, I'm going homeopathic. But you've incorporated both into your practice. Can you share a little bit about that with us?
I'm glad you brought that up. Actually, with osteoporosis, there is a medical supplement that we have that can help people who have thinning of the bones. But in general, people who have arthritis are looking for supplements that can help them rather than medications that maybe they can't take or they've had troubles with. There are a multitude of medications that are out there. There are also a multitude of supplements, and people get very confused. And in our practice, we like to take a holistic approach to the patient, and that would include supplementing your diet, supplementing with herbs, or with what's called a medical food, which is a prescription-based medication now that a doctor does need to prescribe for you.
Why don't you tell us a little bit more about that, because that's something that's really on the horizon, and it's a very exciting field.
It is, it is. There is one that's out there that's called Limbrel, and Limbrel is a medical food that is used to help treat arthritis. And it is well tolerated in patients, especially those who are on blood thinners and people who can't tolerate oral medicines. It's wonderful for a lot of our elderly patients as well. And that's just one of the simple things that we're doing to augment people who have chronic arthritis and pain.
So let's talk about the patient that's watching, the person who's watching, because they're not really a patient until they decide to take some proactive action to come see you or see someone else. So now they're going, well, I think I'll go to a health food store. Oh, gee, there's a homeopathic place down the street. Well, let's talk to those folks and tell them really what they need to know. When should they make the decision to call you instead of trying to do something like that on their own? At what level should you say, you know what, that's not going to do it, come see a real doctor?
Actually, I'm glad you brought that up as well, because any patient that comes into the office, I encourage them to bring their supplements. Bring the bottle in, because you can't read half of what is in the bottle anyway, and we can tell them if that is appropriate for them or not. There are so many additives that are put into these that are not necessary, and maybe we can hone down those vitamins and supplements to one or two that would make life a whole lot easier for them.
So it sounds like you've got a practice really where you have people come in and you say, hi patient, I want to know all about you. I want to take a whole look at you and what you do. Oh, you don't like this, you do like this. Let's try and find some let's call them cures, but they may not be complete cures, but let's find things that advance their or reduce their symptoms so that they can have a better quality of life. That seems to me the life that you live in your office. Does that sound about right?
Absolutely, especially the patient who comes in and says, I hurt all over. And then we have to piece it apart and decide why they hurt all over. And we have an adjunctive approach to adding many different medications, a holistic approach to that chronic total body pain.
A rheumatologist is a medical specialist that treats patients with connective tissue diseases. So that may be rheumatoid arthritis, lupus, gout, and a number of other conditions. But anything that involves joints, your neck, your back, your hips, ankles, hands, elbows, shoulders, all of those things are things that rheumatologists take care of in a non-surgical way. So we use medicines, injections, physical therapy, and other modalities to help patients feel better, function better, and lead better lives.
But there's enough joints in our body, every one of them can be used for an injection. I know for a fact that you personally have injected me in at least 2 or 3 of them, and normally I get really good relief. Why don't you share with everybody what the trends is like? It used to be a lot in the cortisone and what have you, and now there's so many new things going on. Why don't you share with that?
Well, sometimes injections are very helpful for patients who have connective tissue problems because an injection allows a doctor to put medicine into the area where the problem is, and that really can help to minimize the side effects associated with the treatment. Any medicine that can be used in a local fashion is going to maximize efficacy and reduce side effects. So if you have a shoulder problem, a neck problem, a back problem, hip, knee, ankle, using an injection into that joint can be a lot safer and more effective than having to give a medicine that has to go through the whole body to achieve the same result. So local injections can be very helpful for patients, and as rheumatologists we do a lot of what is called soft tissue rheumatology.
Well, let's talk about that because, one of the things you're talking about injections, I can't help but say pinpoint, but you pinpoint what you need and you go specifically to that area, and that reduces a lot of other complications in the body. It improves the healing time, and it gives the patients a lot more freedom to have a good activities of daily living. So why don't you share with us a little bit about where that's all going?
Okay, well, most injections that are performed by rheumatologists are going to be cortisone or corticosteroids, and those are anti-inflammatory drugs that can help to reduce pain and inflammation in a specific site, allow them to function better, and to sometimes do rehabilitation better, physical therapy or other activities to strengthen those areas to prevent recurrence of that problem. But there are other types of injections that can be used. So, for example, in the knees, there are a group of medicines called the hyaluronates, which are derived from rooster combs. Those injections can be very helpful for helping to restore function in the knee. And I believe that later on you're going to be speaking with Dr. Indelicato about platelet-rich plasma, which is a new modality that's being used more and more for treatment of soft tissue conditions of the knee, elbow, neck, back, and other joints in the body. The sphenopalatine ganglion is a group of nerves that sits behind the nasal cavity. And
Back in here.
Back in here.
Back in the, oh my goodness.
And it's been shown to be important in the transmission of pain between the body and the brain. And if you can block this group of nerves, you can down-regulate pain. And so by taking a simple anesthetic on a Q-tip and you can place it onto the sphenopalatine ganglion, you can anesthetize those nerves, and after repeated treatments, you can down-regulate pain and have a significant improvement in some patients with regard to their general pain throughout their body. It's been very effective, and I'm really impressed in those patients where this treatment works. It can make a big difference in their pain and their ability to function and be productive people.